My name is Kamran Ansari. I'm Senior Vice President of Clinical Development Operations at Seagen. Seagen is a global biotech company focused on developing and commercializing transformative cancer medicines to make a meaningful difference in people's lives. Just as importantly, we're also a multinational, multicultural company committed to diversity, equity, and inclusion, not only in our workplace, but also in our clinical research. And as far as I can remember, I've always been interested in science, and up until graduate school, it was going to be the life of a physician. Until I met a peer in graduate school, and he directed me to clinical research, and the rest is history. In my role as a Senior Vice President of Clinical Development Operations, we are, in my organization in operations, we're involved throughout the spectrum of designing a clinical study all the way to completing it and reporting the results. And we're part of an excellent cross-functional team. We have great team members that are deeply involved in conducting high-quality clinical studies, with the urgency that every day matters for patients. And it's not uncommon to hear around Seagen that we are impatient for patients. And as I think about my day, certainly no 2 days are the same. Each day in my life is spent in the service of our teams and challenging us to be better. There's something that we always ask ourselves, and it's something that I've written in my whiteboard in my office is, who have you helped today? How have you helped the team move forward? What is something that's commonly misunderstood or not talked about enough? Recent studies and survey work have shown that a high percentage of patients that enroll in clinical studies are able to enroll when it's offered to them by their doctors or healthcare team. However, a clinical trial that fits a certain patient's need is not always available in their location or where the patient's being treated. And sadly, many times patients are sent home thinking they're out of options when that may not actually be the case. We would not be able to truly demonstrate that our drug is safe and effective in a representative population. And in order to do so, all patients should have information and access to clinical trials. It shouldn't matter where they live or how much money or connections they have at the end of the day to have the opportunity to participate in clinical research. It's so important that companies like ours who sponsor and conduct research partner with patient advocacy organizations like Tigerlily and others to help patients find information about open trials that they can bring back to their healthcare teams. Sometimes this means traveling to different locations for care, but companies who sponsor trials will often cover travel and other associated costs. And ultimately, cancer is a devastating disease, and it's going to take all of us to work together to defeat it. It excites me to work for an industry that creates breakthroughs in this area, and I'm so pleased to be able to collaborate with organizations like Tigerlily Foundation that partner with us to make these advancements a reality.